Welcome everyone. Pretty soon we're going to have the opportunity to see you face to face. But I thought I'd make this video just to give you an idea of what you're going to go through when you come and visit us for your dental appointments. We have unusual times with us with this pandemic, and we've been asked to provide some additional protection within our treatment rooms and for our patients and for our staff. So you'll notice I am wearing some additional garb that you may not be used to me seeing. All of our staff will in fact have this additional garb on them. So when you come to visit us, you will find that you'll be walking out of the elevator and you'll be coming towards our office, and our office will have its door open. With its door open, the idea is you don't have to touch the door. It'll be ready for you. So as we come by here, you're going to notice that we have this table waiting here for you. On this table we have some hand sanitizer, and we also have some information that we'd like you to read before you actually come into the office. So with the hand sanitizer, one pump, and work it into your hands and rub it into your hands. These are fairly effective. If for any reason you don't want to use the hand sanitizer, you're free to go to the bathrooms and use soap and water, and make sure to wash your hands for at least 20 seconds. Okay, so once you've done the hand sanitizer, you're welcome to come into the office. Now when you come into the office, you're going to notice some things that are different. The first thing is we've got these plexiglass shields. And these plexiglass shields are meant to protect you and to protect us. So you will walk up here to the front and you will be greeted by staff who will ask you some questions and also ask you to fill out one of these forms. But before they do that, they will actually take your temperature. And the temperature is taken with one of these infrared thermometers. Okay? So we want to be sure that you're not running a low-grade temperature. That's one of those COVID things. But you will have this done. We will then ask you to sign one of these consent to treatment documents, which again has a series of questions that you need to read and understand, and then you sign down at the bottom. You should understand that all of our staff fill out similar forms every single day, have their temperature taken every single day, just to be sure that they're healthy and that no sickness will pass on from anyone to anyone in this practice. Once you've done this, hopefully you've come in with your own PPE. If not, we do have some masks and we do have some gloves for you. Once you're wearing the masks, once you're wearing the gloves, the next step will be for you to sit down in the waiting room. I do know that our patients do enjoy their coffee. Our coffee machines are still working. We have put protective shields on them. You can still push buttons through this and get the coffee that you enjoy. So you will get that coffee, you will come in, and you will have a seat. Now notice, not all the chairs are available for sitting. We have to have a certain distance between our patients, so we've blocked off certain chairs. So you'll pick a chair that is available, and you'll be now ready to be brought into the practice. When you come to see us, we ask that you do not come upstairs with anyone. Come up on your own. Okay? It's important that we minimize the number of people in this waiting room. That minimizes risk. If you are with someone or someone has brought you, they can wait downstairs and we will call them when it's ready to come and get you. You'll also notice that our waiting room no longer has magazines, and the idea behind that is we don't want you touching too many things. So we will try to stay on time, and we will try at all costs to make sure that you are seen as quickly as possible. So once we are ready to see you, someone will come and get you. They'll be dressed up more or less like this. They'll be wearing a mask as well. They may be gloved as well. But they will come and get you through one of these doors. Now you've been through these doors before. I'm going to take you into one of the operatories now, so come with me. So as you come into the operatory, you'll again notice we've taken a lot of the things out of the operatories. We're trying to keep things as clean and as neat as possible. You will have a seat in the chair, and we will give you something to rinse your mouth out with. Right now we are being asked to rinse out our mouths with a 1% hydrogen peroxide solution, and you're asked to rinse for 30 seconds. And this just reduces the bacterial load in your mouth. You will then have a seat, and we will prepare you for the treatment. The treatments are all the same. You've been through that before. But you will notice that the staff are all wearing protective gear. They will wear gowns. They will probably wear something on their heads. They will have gloves. They will also have a face shield, okay, to protect their eyes. And you will also hear some noises in the operatories, specifically from a device like this. This is an air filter, and this will make sure that if there is any issue with the air in the operatory, we are continually cleaning the air. That's what we're doing. Okay, and there are filters in here that really make sure that the air stays clean. You can see how this has started up as soon as I touched it, and it takes about 15 minutes to clear the air. When you are in here, we will have already done this. So you are walking into a clean room. In addition to that, we have invested in different solutions to make sure that the rooms themselves continue to be clean. This is one of these devices. This is a fogger, and what this does is this uses hypochlorous acid to clean the room. Hypochlorous acid is produced when you mix water and salt and you put an electric current through it. It is accepted by the FDA as a sanitizer. You can ingest it without any difficulties. But it also kills bacteria and viruses. So we use this in the office. We use it to fog the reception area. We use it to fog the hallways. We use it to fog the operatories. And we will use it to fog any area that we think may be contaminated. At the end of the day, we will fog our clothing, we will wash our clothing, but we will make sure that this office is clean and ready to be used. And that's what this is for. So you may hear some noises when we're doing this in some of the other rooms. It's all part of the cleaning process, keeping you healthy and keeping us healthy. So in addition to these things, I just wanted to mention this. This is called betadine. This is a throat spray. You can buy this in the drugstores. And what this does is this uses an iodide-based solution to protect the back of your mouth. I didn't know much about this until I started researching this. This kills viruses, it kills bacteria, and if you spray this in the back of your mouth 3 times a day, the back of your mouth becomes an area that can help protect you from getting viruses down into your lungs. And that's sort of the way of transmission of COVID. So my staff is using this, I'm using this, my family's using this. You can buy this over the counter in the drugstore. It's very inexpensive and it's a simple way of preventing disease. Okay? Sometimes it's hard to find this. I will tell you that. We are in the process of making this ourselves so we can give it to the patients as we see them. Just one of those little tips. We'll have more information for you when you come. So for now, that's really about it. I want you to understand that we've done everything that we can think of to make sure this place is safe, that we are safe, and that you are safe, and that we produce dentistry of the highest quality. We look forward to seeing you very, very soon. Until then, be well, be safe, and be strong. Take good care.